Welcome to the Organic MD podcast with Dr. Damon Miller. My name is Carlisle Koash. How are you today, Dr. Miller?
I'm very good, Carlisle. Thank you. It's good to be here. We got an important thing we're going to talk about today.
Oh, yeah?
Yeah.
Oh, that's right. It's neuropathy or new treatments for neuropathy.
Right. Well, and specifically neuropathic pain. That's a different kind of, it's one thing you break your arm. Yeah, that's painful. That's one kind of pain. But neuropathic pain is a little different in that it's damage to nerves for various reasons. And
I'm laughing because although this is a podcast, we have there are cameras so that Dr. Miller and I can see each other. And in beautiful fashion of the feline family members in our lives, they just love to walk in front of the camera. There's some inherent way they know that a recording is happening. And so it's like, oh, did you forget to introduce me? Because I'm also here.
Yes.
So we're chuckling because the cat has decided that it needs to feature itself right in front of the camera.
Yeah. I mean, the one thing I can promise you is this cat does not bark.
We might hear a meow.
Maybe, yeah.
Or some purring, perhaps.
Well,
anyway, sorry.
Back to neuropathy. Back to the dry, dull
much
subject
more important
than cats. Yes. Maybe not.
Maybe not. Maybe that's what the cat is trying to tell us. Like,
but
neuropathy.
Yeah. Wow, I just lost my train of thought. Well, here it is, though. It came back. We're lucky today. I just wanted to. What I was saying about neuropathy is that neuropathic pain is different than stubbing your toe, breaking a leg, dental pain, things like that. Where neuropathic pain, the nerves themselves are damaged, and they transmit pain impulses even though there may not be an obvious injury. So, some places where neuropathic pain is common are in spinal cord injury. It could be, one thing that people have maybe heard of is even in not just spinal cord injury, but even in, say, amputations, people who lose a limb from an accident or for whatever reason, they have what's called phantom pain. And it can be quite severe. And that's a kind of neuropathic pain. A more common form of that is people with diabetes often develop degenerative changes in the vessels in their legs, so they can get ulcers and non-healing ulcers. But some of the vessels that are affected and that go bad with diabetes in the legs are the vessels that supply nutrition and blood flow to the nerves. And so the nerves get damaged from a lack of blood flow because of the diabetes, and they start transmitting pain impulses, even though there may not be anything visibly that wrong. There's no swelling, there's no inflammation, but there's a whole lot of pain.
Yeah, I think those can be the worst. I worked with enough folks in the hospital setting who would have these things going on, and it's like, but I don't see anything. Like, there's no visible wound. I don't know what it is in our mind almost, where if I see that I have a wound and it's painful, well, oh yeah, it makes sense that it would be, right? Because I can see it. But to not be able to see it, whatever that visual aspect is for ourselves, and so then it feels like no one believes me, or, we've had family members who've this is the 10th time I've gone to the doctor, and I don't know if they really believe me because I'm saying I'm in a lot of pain, but they don't see anything because it's this neuropathic pain. And so there's that extra stress level that can be added.
Yeah, that's a problem. I mean, you begin to doubt your own sanity. And it's very real. People do. They think, oh, you're just making that up. You're just trying to get some sympathy or looking for a reason not to come to work today, or I don't know, all kinds of reasons. And for doctors, it's a little different. Doctors, I hate to say this, but doctors they don't minimize neuropathic pain. They don't. They're not disbelieving you if you're a client or a patient and you have neuropathic pain. They're just trying to make you go away because they don't have anything to do for it. They don't know what to do. They can give you drugs, and drugs are certainly, they become they're the mainstay of the treatment of neuropathic pain if you go to see a doctor. And they've gotten a little better. There are drugs like gabapentin. People may have heard of that. which have become kind of the go-to drugs for that, and they work sort of. They have a lot of unwanted effects, side effects. They can make you feel crazy. They can make you impotent. They can affect your sleep, give you bad dreams. But some people, people are willing to put up with a certain amount of side effects if it's helping their pain. But what we wanted to talk about today were things that are not pharmacy, not pharmaceuticals, and specifically wanted to talk about the use of low-level electrical stimulation to treat neuropathic pain. I'm not going to get into a lot about that. We'll talk in a little bit, just very briefly, about the kind of equipment we use. But, and we've included some research articles. This is a heavily researched area. There's a lot of peer-reviewed literature on this. But with spinal cord injuries and other kinds of neuropathic pain, and certain pain like carpal tunnel, I think there's one article that we're including with a reference to treatment of carpal tunnel pain. That's a kind of neuropathic pain. There's pressure that damages the nerve and it transmits pain. Not just pain, but there's a phenomenon in the way the body works where if a nerve is damaged, the area that's fed by that nerve can deteriorate. So, in carpal tunnel syndrome, in its extreme forms, it starts with pain around the wrist, just to use this as an example. It starts with pain around the wrist, but then your arm starts to hurt, your elbow, all the way up into your shoulder and your neck. You develop something called craniobrachial syndrome, head-arm syndrome, craniobrachial syndrome. And in its advanced forms, your arm just kind of withers up and becomes non-functional. It starts with problems in your wrist, and you end up with a kind of gimpy arm if it's not treated. And it can be treated without surgery. These are important sort of. They're not just alternative. They can be, life-saving, limb-saving sorts of therapies. The other kind of neuropathic pain that is, we talked about diabetes. This is very effective for that. And it's interesting, I think, maybe this is a good time just to talk a little bit about equipment.
When you say that you need equipment, what comes to my mind maybe immediately is, like those TENS units I see, advertised on TV kind of thing.
Yeah, well, it's an important distinction. And we've talked about this before in other podcasts, but there's one of the things that causes some of the confusion in the consumer is that the Food and Drug Administration, the FDA, who regulates these kinds of devices, they don't approve them, but they do regulate the use and manufacture of these electrical stimulation units. And as far as they're concerned, all units that are portable, battery powered, that put out some kind of an electrical signal for treating the body, they're all the same. And they're not. They're not the same at all. So there is TENS units, which TENS is just transcutaneous electrical nerve stimulation. Sounds like a big bunch of stuff. In its most basic form, the TENS unit is what's called a counter-irritant therapy. And what that means is it's taking advantage of a particular characteristic of a human nervous system, which is when you stimulate a nerve pathway and you do it over and over again, that nerve pathway for a time at least, loses the ability to carry any signals at all. And this is the examples to explain this and make it apparent we experience every day. You walk into a room, there's a bad odor. In a very short period of time, you don't smell the odor really much anymore, but somebody else comes into the room and they go, wow, what stinks in here? You put on your clothing. You don't feel the clothing on your body, even though it's stimulating tactile nerves. You put on your wristwatch. You don't feel the wristwatch on your body. You don't feel you run around looking for your glasses and somebody points out that they're on your face. You just don't even feel them there because that stimulation caused by the touch of your glasses on your nose and your ears and your face extinguishes after a while. And you can take advantage of that, and you can treat with a mildly irritating stimulation along the path of a nerve pain like from an injury or a spinal cord injury or something like that. And you can extinguish the ability of those nerves to carry any signal, including pain signals. That quickly fades out. It doesn't work for very long. And it's simply a trick. It's just, you're not healing anything. You're not fixing anything. You're simply using a trick of physiology, nervous physiology, to keep there from being so much transmission of pain. Now, more sophisticated units are only permitted to advertise that they treat pain, but some of these more sophisticated units actually treat the pain by healing the nerve. They increase blood flow, they increase metabolism and ATP production, and allow the nerve to actually heal itself, because it's the damage in the nerve that's causing the pain. And so they're very effective at pain control, but they're doing it by actually healing things. And so we in our practice, we use a machine from a company called MicroStim. You can learn about that unit at their website, microstim.com, and you can actually even buy a unit there. You might need a prescription from your practitioner for it. It is a prescription item.
Stim, like stimulation, like STIM?
Yeah.
M as in mom?
Yeah, MICROSTIM. And, there it's not just a battery with a little bit of electrical irritation. It's contains a microprocessor that creates a complex waveform, tightly controls the current output, the kinds of things that have been shown to be necessary for these units to work at healing tissues, regenerating tissues. And so that's the unit we use. And it's been, we've been using it for over 20 years. They're real workhorses. They're affordable. And, so that's the kind of unit we're talking about, when we're talking about using electrical stimulation to treat pain, not something you buy for, $19 on Amazon. The most interesting case we had here recently was actually someone who had a lot of facial pain following a bunch of dental work. They had, I don't know what it was. I think it was some kind of onlays or whatever they call it, where they glue this stuff to the teeth to make them look more cosmetically.
Oh, yes. Yes, I know. The word is in my. Probably as soon as we stop recording, I'll remember.
Okay, well, you can just shout it to the world then. But anyhow, they had that, and they had some kind of a reaction to the materials that were used, and developed this really horrible facial pain after it. And they'd been dealing with that for almost a year, when they finally, out of desperation, looking around for different people, found us. We got them a MicroStim machine, a microcurrent stimulator from MicroStim, and they used it. They needed to use it for about 4 months before it really put a dent in the pain, but now they're pain-free. So, yeah. And this was after, eating, I don't know how many thousands of dollars worth of medication that their insurance wouldn't pay for, and so it was just kind of a nightmare for them all around. But
and my thought is that it may take a little bit longer, because what this kind of approach is doing is healing those damaged nerves, not just blocking, right? So a TENS unit may seem more effective initially because it's just blocking something, but like a medication, it's just masking the issue. It's not helping heal the issue.
Right.
And so then something like a MicroStim is actually help healing, which may take a little bit of time just for those very subtle things to heal. It takes a little time.
Right. And you do get some short-term relief when you start to use the MicroStim.
Sure.
It has an effect if we have people for the first week or so they're using it. You can set up their treatment protocol so that you're using the machine in ways that reduce inflammation and reduce swelling, which are some things that can accompany the damage to the nerves. That when you reduce those, a lot of pain goes away just from doing that. But then you're right, the regeneration of nerve tissue takes a while, because you're trying to regenerate the most complex tissues in the body. It doesn't happen in a week or 2 weeks. It can take weeks of work. But people people do start to see results right away, and that's why they continue. It's not just that they're better than you and me in terms of their ability to stick with stuff. They're seeing benefits, and that's what keeps them going. That's why they continue long enough for it to really, really work all the way.
Wow.
Yeah. Okay. Well, I'm going to leave that there. And like I say, there's a link to our. We always have a blog post, and that has some references in it. You can read more about the peer-reviewed literature and get an idea from that if you want to go looking further. But basically, just know that there are things you can do. And I do want to mention also just one other thing besides the microcurrent stimulation. Microcurrent stimulation has a kind of interesting relationship to acupuncture, because often acupuncture points turn out to be points of low electrical resistance on the surface of the body. And so they're a great place to introduce electrical stimulation therapies. So often I'm trained extensively in acupuncture besides being an MD. And so the choice of points you choose to treat, depending on where the pain is, are usually based upon acupuncture points. And I say this because acupuncture itself can be very effective. It's not as effective as microcurrent stimulation, but acupuncture itself can be very effective. And a lot of people get good relief from acupuncture sessions if the person knows what they're doing who's treating them. So that's another alternative kind of therapy. And then things like even massage and physical manipulation increase blood flow and move the chi, as you would say. They can be useful. And so it isn't just that you need to go buy a specialized electrical stimulator. There are a lot of alternative things besides meds that have proven to be very useful. Okay. Well, thank you, Carlisle. We'll be back soon.
Yeah, and as always, if you have questions or things, you can email, and we will do our best to answer, especially since there are these extra readings and stuff. If there's at any point you feel like, wait, I don't quite know what they're saying, just let us know, and we'll do our best to try to fill in any blanks.
Exactly. Thank you.